In this section, I'm going to cover how major depressive disorder is diagnosed and the course of the illness. Major depressive disorder is a psychiatric disorder that cannot be diagnosed with a blood test, a CAT scan, or any other laboratory test. The only way to diagnose major depression is with a clinical interview by a trained medical or mental health professional. To be diagnosed with major depressive disorder, a person must feel depressed or lose interest or pleasure in most activities, most of the day, nearly every day, for at least 2 weeks. During this period of time, the person must also experience at least 4 of the symptoms which I covered in part 2 of this program. These symptoms must be severe enough to impair social, work, school, or other areas of functioning. Major depression shares symptoms with some of the other psychiatric disorders, so the person who's making the diagnosis needs to ask specific questions to rule out these other disorders. For example, if the symptoms of depression are less severe but last over long periods of time, persistent depressive disorder might be diagnosed instead. Bipolar disorder might be diagnosed if a person has experienced very high or euphoric moods called mania. If the person has psychotic symptoms while not depressed, they might be diagnosed with schizoaffective disorder or another psychotic disorder. Major depression would not be diagnosed if the depression is a result of a medical condition such as a thyroid problem. Depressed mood that is directly caused by substances such as drugs, alcohol, or medications also would not meet criteria for a depression diagnosis. Keep in mind that even if the diagnosis for depression is not met, symptoms of depression can and should be treated in all of these situations. Let's move on to the onset of depression. The average age of onset of depression is in the mid-20s. However, major depression can begin at any age in life. The frequency of episodes varies from person to person. Some people have 1 or 2 episodes here and there over many years, while others suffer from frequent episodes occurring close together. The frequency of episodes generally increases as the person grows older. The severity of the first episode of major depression seems to indicate the likelihood that another one will occur. The more severe the first episode, the more likely it is that there will be other episodes. Episodes also seem to follow major stressors, such as the death of a loved one or a divorce. Chronic medical conditions and substance abuse both increase the likelihood of having another depressive episode and can cause symptoms to worsen. That concludes our discussion of the diagnosis and course of major depressive disorder. Join me next time as we talk about the causes of the disorder.